Welcome to Expressions of Leadership. I'm your host, Michelle Kawamoto Perry. In every episode, we explore how people from educators and artists to executives and entrepreneurs lead with authenticity, rise through adversity, and share the wisdom they've gained along the way. In today's episode, I'm thrilled to be joined by Dr. Milan Chavarkar, a powerhouse in healthcare and entrepreneurship who has spent over 25 years reimagining what it means to care for women. A nurse midwife, family nurse practitioner, founder of Lotus Integrative Health and Nursing, and now a venture partner and medical advisor, Milan's journey is a masterclass in leadership, innovation, and impact. From fertility to fintech, and from bedside care to boardrooms, she is helping to shape the future of women's health. Dr. Milan, welcome to the show. I'm so glad to have you here.
Thank you. Thanks for having me. I'm so excited to talk to you.
Dr. Milan, can you take us back? What was it that originally drew you to healthcare and more specifically to women's health?
This is how I think every kid gets inspired. We had a family friend who was a physician, and I had to interview him in fifth grade. And he said, one sentence, which I think really struck my heart and brain, which was, I like to help people. And so that really motivated me to think about healthcare and medicine as a future. And as I progressed through school, I was very good at science and just loved dissecting and learning about the body. So that was my interest in healthcare. But of course, as you go through college and you start having work experiences, I felt that my personality was really attuned to helping folks, listening, understanding, helping. And so those are the sort of my, kind of motivation to go into healthcare. I worked at UC Berkeley's Women's Health Clinic, and that inspired me to go into women's health specifically, seeing that women really were not getting the information they needed to take care of their health. Young women regarding STDs and sexual activity, things that you just can't talk to your family about. And, they're coming to the UC Berkeley's clinic and we're getting the information they needed. And I thought that was really helping empower women. And I was drawn to that.
And you've been practicing for over 25 years. What's changed most in the healthcare landscape since you began?
I feel like there's been change, but it hasn't been positive. We are continuing to see healthcare outcomes are worse for families and women specifically. Of course, you see the political environment is changing for women's health. And that has kind of motivated me to move into entrepreneurship. I was in systems, I was in very large uh, community based systems, and didn't really see healthcare change in a way that's meaningful and can improve outcomes. And that started driving me into a different direction 5 years ago.
And was there a personal or professional moment in particular that made you realize that you needed to start your own integrative practice?
I think there were a series of events that would happen that kind of contributed to me moving into this direction. Uh, I started my career in midwifery, and so it was very based in natural women's natural health, helping and serving women in holistic ways. And I had a challenging time being a midwife and getting work and being able to do deliveries in hospital systems. And so I moved into family practice and I fell in love. I think it kind of followed my own trajectory of my life where I was a single woman, a young woman, and then, really interested in women's health, got married, became very interested in family health. But the strongest driver in doing family health was seeing the number of prescriptions I was giving and not seeing a lot of change in people's health. So I was doing a lot of, prescriptions for metabolic disease, hyperlipidemia, hypertension, diabetes. And I had 15 minutes to talk to people, give them a prescription, take some, get some lab orders done or review some labs. And I felt like we were really missing the most important part of healthcare, what drove me to be in healthcare, which was getting to know people and understanding what was at root cause for them, for their health issues. And so this drove me to kind of start seeking other answers. What is the real way we can heal people? There is true healing, there's true understanding of what's happening in somebody and their body, in the context of their family and their social life, their mental health. And what can I do about that? And sort of started seeking answers and taking training in integrative medicine. And it really kind of came to a head where I was just feeling like, I joke I was a drug dealer. I just gave out prescriptions all the time. And I thought, this isn't what I want to do. I really want to help heal people. So I took the plunge in 2020, but it has been an instrumental, uh, life shifting moment for me. And I don't think I can go back to doing medicine the way I did medicine before. I really feel the future of medicine and this idea of true healing. And of course, now it's being labeled as longevity and biohacking. That's sort of the future of medicine.
Now, as you mentioned, Lotus Integrative Health and Nursing was launched in 2020, which was a pretty challenging year for many people. What was it that made it feel urgent or necessary for you to start the company at that time?
I was definitely at a crossroads of my career. I had uh, taken time out of family practice, was working in urgent care at a major hospital system and doing my doctorate. And finishing the doctorate, I actually had gone into the doctorate program at UCSF thinking I would teach, and took an entrepreneurship class there and thought, what the heck, might as well try this. And I was definitely, you need to be in the right space and place in order to be an entrepreneur. So that happened to be 2019, at the end of 2019. So I certainly did not plan to open a business, during it happened right before the pandemic. But the good thing about being in the pandemic was, um, it, it it really cemented my resolve. This is the most challenging time for anybody to open a business. And I certainly went back to working in a major medical system during the pandemic, feeling that my other colleagues were all working. And it's probably one of the most momentous times for a healthcare professional to be available and to be helping, our community. So I did go back and work while I was, starting my business, and it was very stressful to work during the pandemic. I don't think I've ever been that stressed, and while working ever in my whole career. Just the conditions in which we were all wearing masks and gowning up, and the fear for patients, the fear for providers. Uh, but it teaches you resiliency. It teaches you um, to keep moving forward. It also reminded me of the reason I opened my own business, which is to make healthcare a better place for women and families. And so it just kind of created that resolve. The pandemic kind of really, like, okay, I put my flag in the ground, and I'm going to do this. And I kept going until I started getting enough patients, and then I let go of that other position so that I could concentrate on this fully.
And what kept you calm during those times?
Oh gosh, I don't know. I don't know if it's just in our personalities as healthcare professionals. I think I've always been one of those calm providers. You have to be, I think, in order to be in healthcare, you have to be a calm person. I have faced patients who've been very angry, upset, disturbed, have heard very terrible news. So I think after 20 plus years of practice, facing the pandemic was um, not uh, it was in my nature to be able to face that challenge. And I think inside where we're all, all of us, everybody in the whole world was terrified. But as a healthcare provider, you have to be that person who's strong for your patients.
And did you find that having that demeanor really helped your patients to start to feel more calm as well?
I do think that our energy and the way we present ourselves is then absorbed by our patient. And, um, you know, I definitely spent a lot of time calming pregnant mothers throughout the pandemic who are very worried about their babies and their newborn babies and delivering in the hospital. So uh, it definitely, it helped them to have a caring, loving face and person who could help them understand the hospital system, what was going to happen to them, how they were going to be cared for, how we were looking out for them. So it does help to have. I mean, I think that's the most important thing about being a healthcare professional is just being that face of being a caring person, and it makes a big difference. In fact, when I teach students, it's the number one thing I tell them. They're all worried about whether they have X, Y, and Z knowledge. Oh, I don't know what treatment I'm going to use for that condition. And I always tell them, don't worry about that. You can look that up in a book or look that up on a computer. Make sure you care and you listen, because you know what? You will learn everything you need from your patient, and that will take you, 80% of the way. And looking up the treatment or figuring out what you're going to do will come to you. Or if not, you look it up or ask a colleague and you will get that together. But that's the most important aspect of being a healthcare professional.
And I think that listening to the patient is really critical because they're going to tell you things that are going to give you clues into a better diagnosis if you truly listen versus just making an assumption about what might be happening and then perhaps misdiagnosing them.
That is, I think, the crux of the problem in healthcare right now. I mean, I think if there's, you know, one area that I think we really need to work on is time. I think we've lost that time with patients, and if we had that time, that's the thing. That's probably the most impactful part of my practice is I have an hour-long visit with the patient, and it's the thing that I love the most about my practice is truly understanding. And even an hour feels short sometimes. I mean, people are so complex. They have such long histories. There's so many reasons they are where they are right now. And health wise, whether it's physical, spiritual, mental, if we look at people holistically and we want to truly help them heal, getting to know them is the most important part. And we're missing that in the healthcare system today.
Mhm.
It's probably the biggest compliment I get from my patients is you're the first person I've ever talked to that really listened. And uh, it makes me want to cry sometimes because I think there's so many people out there that aren't getting listened to in the healthcare system. And how do we change that? I mean, isn't that our goal, is to listen and to learn and then to help and and give them guidance based on their own individual uh, background and issues. We often just kind of just it's almost like a recipe book, and that was what drove me to functional medicine. I think the individualization of really coming up with a treatment plan that makes sense for a patient and what's the most important thing that they want to work on. What's the most important aspect of their health that they want to work on? So that's the lovely thing about what I do, and I love what I'm doing. Um, so I feel really grateful every day that I get to have this style of medicine, which I wish we could do for everybody, because I think we would see healthcare improve dramatically. And when I say, oh, in the last 25 years, I have not seen a lot of there have been improvements. We've seen a lot of incredible pharmaceutical discoveries, diagnostic tools. We're definitely helping folks with very complex disease in a better way. But we really have missed the boat on prevention and helping uh, people with the most common issues, and that being like metabolic disorders, uh, cardiovascular disease comes to mind. I think that we always assume in women's health that breast cancers are probably the number one disease, and it really is cardiovascular health. So what are we going to do about that? And these are the things that I want to look at. um, you know I'm sort of uh, I wouldn't say I'm at the end of my career, but I'm definitely seeing the light at the end of the tunnel. So I think, okay, I've got this 25 years. What am I going to take from this 25 years I've done and really make life better for families?
Well, we're just getting started with this very rich conversation. Coming up next, Dr. Millen talks about shifting from clinician to entrepreneur and the values that guide her leadership every step of the way. Stay tuned. We'd love for you to be a part of the Expressions of Leadership community. Follow us wherever you get your podcasts and connect with us on Instagram and YouTube at Expressions of Leadership. You're listening to Expressions of Leadership. I'm Michelle Kawamoto Perry, and I'm here with Dr. Milan Chavarkar, who's showing us what it means to lead with heart, purpose, and precision. Let's get back into it. How do you define leadership in a clinical or caregiving context?
To me, leadership has always been about being the best you can be and being and showcasing that and mentoring others. And that is primarily what I've done in the clinical setting by being a volunteer professor at UCSF, and I have students come through. I, I feel that that has been the way that I've shown leadership is to really showcase my clinical skills, being the best that I can be, how to care for patients, showcasing that in sort of the most ideal way, and teaching others of a younger generation on how we should be approaching healthcare.
And as a founder of Lotus Integrative Health, how did you make that mindset shift from clinician to entrepreneur?
So I don't think I ever let go of being a clinician. I'm always going to be a clinician. That's in my blood. But what I did do is add on those skills to be an entrepreneur. I have in the past been in managerial roles and operational roles in health systems and clinics. So making the shift to having my own business was not a huge leap, but there were a lot of skills that I had to learn, which I didn't necessarily have. You don't learn how to run a business in nursing school, in nurse practitioner school. And those are things that I had to pick up on my own. And I did hire a coach. I did a lot of online reading. But I learned how to use QuickBooks, how to do my own accounting, how to set up systems, how to set up electronic health systems, how to, use Slack. It was fun in a sense that I think there was a lot of growth there, and it definitely moved me to understanding entrepreneurship, understanding business at a different level, what it takes to be an entrepreneur, how do you start a small business. So many skills I learned, which some of us have a knack for, and I felt I did. And that has kind of started growing in ways that I had never seen before, and started enjoying entrepreneurship, which I did not anticipate. I really, in the beginning, thought I would just be working on integrative and functional medicine, uh, but it has turned into more.
And in addition to those skills that you had to learn, what were some of the earliest leadership lessons that you learned in running your own practice?
I've never been a patient person, and I think you really learn a lot of. I thought kids would teach me patience. I think having a baby business teaches you a lot of patience. There is a lot of patience in the early stages of entrepreneurship, and a lot of ups and downs. And I had heard about the ups and downs from various friends who had businesses, my coach, my business coach. But when you experience those ups and downs, you have a month where you've had no patients, no new patients. And you're going, oh my gosh, what do I do? How am I going to keep running this business? I haven't had any new patients come in. So you start learning to weather the ups and downs, and that the the patience required in any startup phase for a business is the patience required is immense, and it's a good lesson. It's a good leadership lesson I think most of us want to rush and get to that next phase of your business. But when you do reach the next phase, you look back and you're really proud of yourself. Wow, I did that. I got to this phase where I have steady business. I have people who like what I'm doing, who are willing to pay for what I'm doing, that they're seeing incredible outcomes with what I'm offering. So it's really rewarding in that sense. And I would say that's the greatest lesson I learned in this entrepreneurship journey.
Now, speaking of down moments, can you share a moment when you faced a significant challenge in your career or business and how you overcame it?
Wow, there's so many ups and downs. I think the pandemic was a huge one. And I thought, oh my gosh, I'm crazy. I'm opening a business. There's a worldwide pandemic happening. But that was one of the moments where I felt like, is it just better for me to go back to working for others? Uh, but I had already tasted, uh, the sort of sort of beginning phase of seeing patients, having my own practice, being able to do work in medicine the way I wanted to work. So I didn't want to give up on that.
And your approach is deeply rooted in time, partnership, and prevention. How do you advocate for this model and a system that often values volume and speed?
I I feel I'm an example of the outcomes you can get from taking the time to get to know your patients, really truly analyze uh, their root causes, their background, what could be really driving their disease, and the outcomes speak for themselves. That's what I'm hoping is we see sort of a surge of functional medicine happening, certainly from 5 years ago to now. When I started 5 years ago, I felt still functional medicine was sort of almost a bad word. Like, oh, you're one of those people doing functional medicine. And now I see this respect and desire to learn, patients coming in who've heard, uh, some of the gurus in functional medicine talking on TV and social media, and wanting to understand what is the approach, how is it different than conventional medicine, and what are the outcomes they're going to see. And after 5 years, I can see the outcomes clearly now. And in the beginning, I was a little unsure of would this, I'm learning about how functional medicine can understand root cause disease, how we can look at lifestyle, behavior, health, and address diet, look at herbal medicines and supplementation as a way to uh, sort of address what's happening at the cellular level. Now I see it 5 years later, hundreds of patients later. There's so many incredible outcomes. I've worked with patients of all different backgrounds, all different health issues. My specialty is in menopause and fertility and women's health. And in those areas, I've seen incredible outcomes that I would never have seen in conventional medicine. Specifically, women who are in their later years, early 40s, getting pregnant naturally. And I would never have seen that in an OBGYN office that I worked at.
Well, up next, Dr. Millen walks us through her shift into innovation and investing and how supporting startups has reshaped her career. Want to support powerful conversations on leadership and success? Expressions of Leadership is looking for sponsors who believe in the power of great storytelling. Let's team up. Email us at letstalk@expressionsofleadership.com to learn more. Welcome back to Expressions of Leadership. I'm Michelle Kawamoto Perry, and my special guest today is Dr. Milan Chavarkar. Let's continue our conversation. You've stepped into the world of venture capital, advising startups and investing in women's health. What sparked that leap?
It just fell into my lap, sort of. I was having some conversation with a group of women about investing, and all of us are, mid to late careers. we still have some time to work, but we have some accumulated some funds that we could invest. And I was talking to a group of women. They were chatting with me and they said, Millen, you're so smart. Figure out where we can invest our money. And I said, why are you looking at me? Why am I the one that you think you're the entrepreneur? You've started your own business. You know what you're doing. And I happened to mention this conversation to a patient of mine who is Ritu Gupta. She was a patient at the time, and we had finished our visit, and I started just chatting with her, and I said, I'm really interested in investing. And, do you have any thoughts on that? And interestingly, Ritu is in How Women Lead and has been a proponent of how women invest. And she was having an event at her house. And she said, come on to an event at my house. I'm getting a group of women together who are interested in investing and learning about, venture investing. And I thought, okay, sure, let's do this. And I happened to meet Jessica Carr from Coyote Ventures there. And her specific thesis is around women's health, which of course is my, passion. And we started talking. She started talking about some of the companies she's investing in. And I just looked at her and said, okay, I'm in. Tell me what I do. And I really just jumped in. I think because I felt after this long career of seeing very minimal change in women's health, I want to be involved in entrepreneurship where we can see those changes. And I don't see them coming from big systems. I've been in those big systems. Those big systems have no incentive to change. And as far as I see, entrepreneurship is the way to change healthcare. And if any, this is the time to do it with sort of the momentum we've seen in technology and now AI. We really have the tools at our fingertips to improve healthcare, I think, in ways that we won't even, we're just on the tip of that. We're going to see some phenomenal, that's my prediction. We're going to see some pretty phenomenal changes in the way we can help patients. But in my estimation, we should not let go of the clinician as the centerpiece of providing that technology. When we let go of those human relationships in healthcare, we lose the depth of the healing that can happen. And I can testify to that in my own practice because obviously the time I spend, if I have 1 hour long visits and I'm using root cause analysis to come up with treatment plans, but then I'm spending the time to teach them and encourage patients and help them with behavior change, then that's where the results are coming. It's not just from going to come from technology. It's going to come from the combination of technology and healthcare providers, all the healthcare providers. And so I wanted to make sure that as a clinician, I'm involved in that because I think we're seeing a lot of folks with amazing ideas using technology and AI, but there's no clinicians in the room. And it's, I think, a big mistake. And patients. We should also have patients in the room. And when we have the people who are going to be using this in the room, we're going to actually tailor make innovation in a way that's really profoundly going to impact healthcare. So that was sort of my motivation to entering the venture world. It kind of happened, and I thought, well, this is my way to contribute. Um, it's interesting. One of the first things I wanted to do as a midwife, when I graduated as a midwife, was open my own birthing center. And unfortunately, at the time, the climate was not there where birthing centers were really financially viable. And, a midwifery practice with a birthing center. And that was my initial entrepreneurship dream. And as a VC, I invested through Coyote in Millie, which is a midwifery practice that's just opened their second clinic. And it was such a full circle moment for me because I felt like I couldn't do it 25 years ago, but here are now new generations of women are opening practices and businesses that are going to make those changes that are going to be so instrumental to improving women's health.
Now, I would like to circle back to your comment about large medical providers not being motivated to change. Why do you think that is?
Medical systems have no incentive to change because everybody's sort of working in unison to provide sort of minimal health care. And this is my opinion. We have our insurance systems, our larger medical systems, we have our pharmaceutical companies, and we've kind of sold everyone this idea that this is the way healthcare should operate. This is how everybody's going to be making their money. And my thought is we're providing this minimal care to keep people going, but we're really not providing optimal care and we're not preventing disease. So there isn't any incentive to change because people are rewarded for disease. The more disease there is, the more payment there is. And when we change and shift the system to the reward is prevention or preventing disease, is where we will see better outcomes in patients. So the way the system is built now is it encourages disease rather than prevents it.
What are some of the key gaps that you see in women's health innovation in particular today that you're passionate about helping to solve?
I think understanding, again, I think I keep saying root cause, understanding the root cause of disease. So when I see women struggling to get a diagnosis of endometriosis 7 to 10 years, you know, later than should be happening. For example, a lot of women come in with pelvic pain and, uh, or period pain, and we're missing that diagnosis of endometriosis. I think diagnosis and testing and diagnosis of disease early on is really a huge um, underfunded, under researched area. I think we're getting a lot of momentum on that now. We're seeing companies who are coming up with tools to diagnose endometriosis. So that's one example of a disease that I'm really uh, kind of looking out for solutions for, just because the struggle is so real, especially in relation to the work that I do in fertility. We're seeing such delayed diagnosis that, of course, when women are approaching fertility, and of course, women are delaying uh, childbearing. So without that knowledge, there the setback is even bigger. So in women's health, I really want to see more innovation around diagnosis. I think every area we need diagnosis, treatment, care, coaching. So many gaps. Another gap that I see in healthcare in general is support for clinicians to do their job. The fact that I see patients going out of their systems to get ancillary care, whether it's for hormones or, you know, whatever issue it is. These services should all be within the system that's there for them already, and they should be able to use their insurance. When I look at companies that are coming through, I really want to see companies that are working within the system. I don't, the burden of healthcare is already so high. Why are patients having to pay extra beyond their insurance for services? And that's a frustration for me, even in a private practice, you know, which doesn't take insurance. I myself admit my own practice does not take insurance, but I also can't give an hour long visit with taking insurance. So we need to solve those problems in healthcare so patients get the things that they actually need in the systems that they're used to, with the providers that they're used to, using their insurance. And that's the goal of anything that I'm going to work on in the future.
Let's now shift to your new health AI company, PriMi Health. Can you tell us more about what inspired it and what problem it's trying to solve?
So I use functional medicine to address fertility issues and understand fertility uh, problems for couples. And one of my patients said, "I'm checking everything you're doing on ChatGPT." And I thought, okay, this is interesting. It sounds like, we could use AI to understand what is happening. And especially a lot of folks with infertility are told there's unknown etiology. We don't know why you're having fertility issues. Well, clearly there's a reason they're having fertility issues. We just haven't come up with, again, the tools to be able to explain what is happening. And so when she said, I'm using ChatGPT and checking what you're doing, which is, when I'm seeing patients, I'm looking at all their labs from a functional medicine perspective, really looking for underlying inflammation, dysbiosis, metabolic disease, thyroid dysfunction. How is stress contributing? How is diet, lack of exercise or movement contributing to health? So, can we use AI tools to do those same things? And we can. So, I'm working with a team of incredible biomedical engineers. My co-founder Priyanka Vedya is also someone who's worked in this field for a long time and using AI and MLM to understand how to understand what's happening at the root cause. And we are going to develop clinical insights and wellness reports for fertility couples so they can work with their clinician and address those issues. This very much the same way that I do in my practice, but we're going to make this available to clinicians, and we'll see. Yeah, we'll see how it works out. I think patients are going to be really excited to be able to understand what is happening to them from a fertility perspective. How can they improve their fertility and see some outcomes from that? And I've seen those very outcomes doing this in my practice. So I'm hoping we can expand on that by giving AI tools to other clinicians. So we're excited to be launching that and starting developing our platform, and we should have a product ready within 3 to 4 months. So
And you work with several early stage companies from Maternal Plus to Fibra and Braid. What have you learned from that experience?
it's been fun to work with early stage companies and understanding the process, the resilience, uh, the issues that come around a startup. Um, whether it's raising money to employees, uh, to co-founders, all the different issues that come together in an early stage company. The excitement around new technology, being able to provide a service, create, see the market response. Most exciting is to see what it takes for a company to be on the path to success. And it's all of those factors that have to come in alignment with a little bit of luck. And it's fascinating to me. I think because I'm a midwife, I always think in terms of pregnancy and babies. And when I look at companies, I think it's like you're gestating and you're creating something that's just profoundly amazing. And at the end, you're going to have this product, a baby. And maybe it's a bad analogy, I don't know. But I think because I'm a midwife, I always think in terms of that. Creation is so beautiful. And, you come out, and of course, a baby is much more exciting than a company. But a company is like a baby, and you're growing it, and you're gonna have those phases. I always joke that uh, my practice just hit its 5 year mark, and I go, oh, we're in our elementary school phase now. We're going to school. It's very much like parenting and having children, and maybe as a mother, that's why I always think of those analogies. And it's a very female centered way of thinking of business, but it's a lot of fun. It's a lot of fun to be in that stage. It's very exciting. It's also a lot of work. And we've all had sleepless nights, if you've had children. And it's the same as a early stage company. There's nights where I'm up in the middle of the night thinking about, oh gosh, how do I take care of this X, Y, and Z idea? Or, oh, I need to address this problem. But there's something really lovely about creation and doing something innovative and fun and new. And the hardest part is keeping the momentum going and maintaining that energy to keep growing and escalating. And that's actually probably even harder than the startup phase, in my estimation. But um, that's the all the different things that I've learned about entrepreneurship and these early stage companies.
We're going to take a quick break, and when we come back, Dr. Millen will reflect on how values like mentorship and purpose show up in her work and her life. Leadership isn't just about strategy, it's about people. The Forward Project helps organizations cultivate strong, adaptable leaders who create thriving workplace cultures. If you're ready to invest in your leadership team, visit www.theforwardproject.co to learn how. You're listening to Expressions of Leadership. I'm Michelle Kawamoto Perry, and I'm here with Dr. Milan Chavarkar, whose dedication to mentorship and systems change is as inspiring as it is impactful. Let's dive back in. How do you cultivate that trust and connection, whether with patients or partners or your team? And how has that shaped your approach to leadership?
Throughout our careers, I think the most challenging issue is time. And it really impacts your ability to communicate and connect with people. And so, one of the most key pieces of my leadership style is creating time to connect and communicate with others so that you can develop that trust um, between whether it's your family members, your team members, your patients. I feel like time is so short for everyone and we're all racing against it. But at the same time, we can't just not value that time with others. We're so anxious to get to where we need to go or do what we have to do. Spending that little bit of time, even if it's an extra 5 minutes or is creating that connection. And I'll give you an example. You know, when we go into a meeting, we have half an hour meetings, and that's kind of been what I've noticed. And it's a challenge for me as a talkative person because as a social person, my and a clinician, my instinct is to connect and to spend that 2 minutes to ask how your family is, what's your day like, how are you doing? And in the business world, I think there is this sort of boom, let's get right to it. What do we need to figure out? And I think spending that little bit of time, that 1 or 2, it doesn't have to take a long time. Spend an extra minute asking somebody how they're doing and communicating and being a person. I think it creates that trust and connection better.
It's taking those moments that are typically transactional and making them into moments that are transformational. And it doesn't take a lot of time. What it takes is the willingness to have that connection with the other person.
We're still humans in a technology world, especially in Silicon Valley. We still can't forget we're humans. And again, I think it connects back to the most important piece of the work that I want to do is how do we connect technology to help us be better humans?
You mentioned that entering entrepreneurship later in your career was transformative. How did it change you?
I feel as a younger woman, I was so busy raising a family. It was really hard to gr- I still continue to grow in my career, but within the context of having a family and doing that day-to-day grind that I think a lot of us mothers and parents are in. And so as my kids have sort of aged into early adulthood, it's given me the freedom to really look more creatively at how I would like to work, how would I like to express uh, my talents, uh, how can I be creative with the ideas that I have, how can I express myself, how can I change the world around me in a better way, and can I bring other people along and uplift them as well. And that's transformative because I did feel I was very focused on my family at that younger mother stage of my life. And now I can take those lessons and move them into a space where I can also work on myself and grow in a different way And I think that feeds into also being a model for those around me, whether it's my children or my family members or friends, that just there's different phases of our life, and every phase has its benefits and challenges. And this is a different phase, and I get to be a different person in this phase and embrace. I'm in perimenopause, embrace that space, and it's not, a time that's it's not an ending, it's a beginning, and I think a lot of women my age are facing that. I think when you stopped raising your children, you're kind of done, and you stop working, and that's it. And I see it has changed a lot for women now.
Now, as you mentioned before, you're a volunteer faculty member at UCSF. Why is mentorship and education so important to you?
We need to teach the next generation. And if we're not involved, who will be involved? We all need to teach the next generation, whether it's, mentoring your neighbor or your family member or volunteering at a school. I love mentoring uh, nursing students, nurse practitioner students. They are looking for, especially most of them are women, so they are looking for mentors. Many students come from backgrounds where they have no mentorship in their family of somebody in a healthcare field. So I've found a lot of satisfaction from helping the next generation, um, supporting women. Of course, women supporting women. It's always, been a part of my life, and it's my way to continue my legacy and help uh, others understand what's most important in healthcare. And we all need guidance. We all need mentorship, whether it's you know at any age and at any level, right? So it's just my way of giving back, and I will continue to do so. And whether it's through UCSF or other places, even in my own businesses, I'm always mentoring others, and it gives us such satisfaction, job satisfaction, career satisfaction to mentor.
For you, what are the most rewarding parts of mentorship?
I feel the most important part of mentorship is not just giving, it's also you end up getting. You don't realize it, that you end up learning something about yourself. And it's an opportunity to learn something about yourself in a different way. When somebody challenges you, which most of the students at some point will challenge me with something, whether it's a piece of knowledge I don't know, or a study, or something they've learned in another class. I feel that not only have I taught them, but they've taught me something too.
Well, we're going to take a quick pause. Before we wrap, Dr. Millen will share her thoughts on legacy and her wisdom for future change makers. Don't go anywhere. Don't miss a thing. Follow Expressions of Leadership on your favorite podcast app and connect with us on Instagram and YouTube at Expressions of Leadership. We're back on Expressions of Leadership. I'm Michelle Kawamoto Perry, and I'm joined by Dr. Milan Chavarkar, a woman whose story proves that bold shifts, even later in your career, can lead to powerful new beginnings. Let's close with a few final questions. You mentioned legacy before. What legacy do you hope to leave in the world of women's health and leadership?
Wow, what a big question, right? I mean, what do you leave this world with? I'm hoping that the work that I do in the next 10 to 15 years is helping empower women, improve their health, improve their families. And that's always been my goal from day one, is working in women's health. I want to help people. Sounds so simplistic, right? From age 10 till now, it still is the same. Um, but it in a way that I think resonates with the new world we have, and seeing that AI is on the rise. How can we harness that power to impact in a positive way and be uh, with AI coming into healthcare? How can we as clinicians make sure that AI is benefiting and not hurting and distracting? Because I certainly saw, when electronic health records came, it was to some degree more of a distraction than an assistance. And everyone thinks, oh great, new technology, we're going to do something new, it's going to be great. There's a lot of other factors to consider in healthcare, and we need all the stakeholders at the table in what we're going to take, how we're going to adopt new technology into healthcare. So that's kind of the legacy I'm hoping to lead, is to use that clinical skill of 25 plus years to benefit the next generation. So they get the benefit of all that knowledge and what works, what doesn't work. How are we going to implement this in a way that really improves outcomes? And when we look at our health outcomes, they're poor. That shouldn't be the case. We're, one of the most well off countries in the world. And, we shouldn't see poor health outcomes for our citizens.
Dr. Millen, if people want to learn more about you or your practice or your investments, what's the best way for them to contact you?
So anybody interested in my practice can go to the website www.lotusintegrativehealth.com, and I do offer a free discovery call for any potential patients. If otherwise, the other way to get a hold of me is through LinkedIn, Milan Chavarkar, and I'm there on LinkedIn, and you can contact me through messaging there.
And now for the final wisdom and whimsy segment of the show, where we ask our guest one advice question and one fun question. Let's start with the advice question. For women who want to lead with purpose, whether in medicine, business, or both, what's one piece of advice that you'd offer them?
Women need to listen to their instincts more. We have very instinctual people, and um, I feel uh, we often, we should also lead with our head and heart, but I often lead with my gut, and my gut tells me a lot these days. And so if your gut's telling you to move into a certain direction, uh, don't discount it. I think listen to it and explore it. Maybe use your head and heart too to explore it. But a lot of the decisions I've made in my career have been instinctual, and it's gotten me where I need to go. So I've listened to that instinct to follow what was my passion, and go with it. Don't be afraid. A lot of us get scared, and it's normal. There's a lot at stake in any decision you make, right? Whether it's financial, career, family, you name it. That we have so many considerations in any decision we make, but don't discount your instincts.
And now for the fun question. What's your favorite smell in the whole world? And what memory does it bring back?
Oh, it's rose. I love roses. My grandfather used to grow roses in his garden in India, and my mom's taken that up. So, I remember going around in his garden in India and smelling all the different roses. So I love the smell of roses. I love rose perfume. I think it just reminds me of a happy time in childhood. And then my mother is also a big fan of rose. So it reminds me of her. So, and she's my inspiration. So
What a sweet memory. Well, Dr. Milan Chavarkar, thank you for sharing your story and your mission and your leadership with us today. Your journey is a reminder that care, real intentional care, is powerful leadership.
thank you so much for having me. This has been fun.
And to our listeners, thank you for joining us. I hope what you heard today reminds you of your own power to shape change and lead with intention. See you next time. If you haven't done so already, make sure to click on that follow button so you don't miss out on future episodes. Have a guest you'd like us to interview? Questions, ideas, or just want to say hello? You can reach us at letstalk@expressionsofleadership.com. or connect with us on Instagram or YouTube. We'd love to hear from you. And as always, thanks to our amazing team behind the scenes for making this podcast possible, including our sound engineer, Graham Palmer, and my chief encourager and advisor, Jeremiah Higgins.